Well, our big story this morning is on the Covid-19 vaccine front. Novavax has announced that its Covid vaccine is more than 90% effective, including against coronavirus variants of interest as well as variants of concern. The announcement was made after a large-scale US study. The study involved nearly 30,000 people in the US and Mexico. The company has released these results on Monday, showing that the vaccine is 90% effective overall. Now, Novavax, interestingly, has a tie-up with the Serum Institute of India, which is why it presents itself as a potential hope for another vaccine for India.
It's likely to be somewhat more expensive than Covishield, but that price hasn't been decided. There were some delays initially expected in its manufacture, but that's actually been sorted out by the US President Joe Biden. When the Serum Institute's Adar Poonawalla actually said that there were some delays as a result of raw materials not being provided by the United States, he was actually referring to Novavax. So that's going to be manufactured over here. And it appears that in the third quarter alone, in other words, by the end of September, they will have had worldwide, and a large part of this is expected to be India, 10 crore doses. So this is going to actually come very soon. And the fact that this has been cleared means that as per the new rules in India, emergency use authorization can also actually take place in our country. So that's all good news, because just a few days back when the government listed a couple of vaccines, this was not listed. But with this clearance now in the United States, anticipated very soon, they will apply for EUA over here, and then manufacturing is all set up. It just needs to start in large numbers before it comes here. More vaccines means more people in our country can get vaccinated, and that is welcome news as we try and get all adults vaccinated by the month of December, the end of December.
All right, on to the big political story we're tracking this morning. The BJP, in a bid to start some kind of a damage control exercise after the criticism of the government about its handling of the Covid-19 pandemic, has now started something called Seva Hi Sangathan. Now, this is a program basically aimed at tackling the criticism of the government in its handling of the Covid-19 pandemic. The BJP President JP Nadda has instructed BJP workers to help with vaccination drives, relief programs and training healthcare volunteers as well. All right, well, let's also get you the other big story that we're tracking this morning. Two opposition parties in Uttar Pradesh have accused the Ram Mandir Trust, which was set up by the centre last year, of pulling off an illicit land deal in Ayodhya. Now, this involved two real estate dealers allegedly purchasing a property from an individual for 2 crore rupees and selling it minutes later to the trust for 18.5 crore rupees, according to the allegation. The trust says that all transactions were made in a transparent manner. Here's the full story.
This nondescript plot of land in Uttar Pradesh's temple town Ayodhya, 5 kilometers from the site of the proposed Ram temple, has become the center of big controversy after allegations by opposition parties, the Samajwadi Party and the Aam Aadmi Party, that it was bought by the Ram Temple Trust at a massive overvaluation in March this year. So this land over here measures 12,080 square meters, and that is a big area. The allegation from the opposition is that this land here was brought by two property dealers from the original owners for just 2 crore rupees, and within a matter of minutes, just 15 minutes, it was transferred in a sale further ahead to the Ram Janmabhoomi Trust for a whopping 18 crore rupees. So that multi-fold increase in price is under question. The other interesting allegation, of course, is the fact that on both the agreements, the witnesses are same. These papers for the registered agreements for both transactions, released by a local Samajwadi Party leader and not denied by the Temple Trust, list Ayodhya Mayor and BJP leader Rishikesh Upadhyay and Ram Temple Trust member Dr. Anil Mishra as witnesses for both transactions. One between the property dealers and the first owner for 2 crores, and the other between the dealers and the Ram Temple Trust for 18 crores. Ayodhya's mayor claims he did no wrong by appearing as witness for both transactions.
ये राजनीति से प्रेरित है। ट्रस्ट क्लियर करेगा जिन लोगों ने दिया है। मैं तो मेयर के नाते लगभग जो भी मंदिर आए हैं उसमें मैं विटनेस करता हूं। और सब ऑनलाइन ट्रांजैक्शन ट्रस्ट करता है, तो उसमें कोई हेरा फेरी इस प्रकार करना उनकी बौखलाहट है। जो भ्रम फैलाया गया है वो दूर हो जाएगा।
Late last night, the temple trust put out a statement claiming the original buyers of the property dealers, had entered into an agreement with the owner years ago for the price applicable at that time. In March, they formalized it at the same rate and then sold the property to the temple trust at the current market price. A lock at the home of the original owner, and no explanation of how the difference between the two transactions carried out within minutes was a staggering 16 crore rupees.
हमको आरोप लगते ही रहते हैं। मैं 100 साल से आरोप ही देख रहे हैं हम लोग। हम पर महात्मा गांधी की हत्या के आरोप से हम चिंता नहीं करते।
At the residence of Ravi Tiwari, one of the brokers involved in both transactions, no word on his whereabouts.
आप क्या उनके बड़े भाई हैं? या छोटे? लेबर है सर। ये तिवारी जी भी है, प्रॉपर्टी का काम करते हैं। हमें मालूम नहीं। आपको नहीं मालूम? So this is what happened when we went to one of the residences of one of the property dealers here. There was one gentleman here who simply left the home and escaped and did not tell us where this property dealer was. But one thing to note is that this property dealer lives very, very close to the residence of the Ayodhya mayor, Mr. Upadhyay, just about 100 or 200 meters. Of the two property dealers involved in these transactions, one of them is Mr. Sultan Ansari. This is his residence here in an area called Sutahati in Ayodhya. So we went inside and we asked his staff where he was, but they told us that he left home early in the morning for some property related work and he hasn't come back since.
The Uttar Pradesh government only had this to say.
हाथ राम भक्तों के खून से रंगे हैं, सलाह ना दें। अगर कोई किसी ने भी गड़बड़ किया होगा, ट्रस्ट उसकी जांच करेगा और जो दोषी होंगे उनके खिलाफ कार्रवाई होगी।
But it's unclear how the trust will investigate its own alleged wrongdoing. In Ayodhya with Pramod Srivastav and camera person Vineet Verma, this is Alok Pandey, NDTV.
Well, on to the big political focus. An overnight coup in Chirag Paswan's Lok Janshakti Party, the LJP, led by his uncle, has left him isolated at the top. 5 rebel MPs voted to replace Chirag Paswan, the son of the party founder Ram Paswan, who remember died this year. And on Monday, they instead elected his uncle Pashupati Kumar Paras as the leader of the Lok Sabha instead. Now later, the Speaker Om Birla endorsed the decision, leaving Chirag Paswan replaced as the Lok Sabha leader in the party he heads. Here's a report on how it all unfolded.
The family drama of the Paswans played out in public as Chirag Paswan, son of party founder Ram Paswan and current president of the Lok Janshakti Party, met his uncle to save his party from splitting, but failed. 5 out of 6 MPs in the Lok Sabha, led by his uncle, have asked the Lok Sabha Speaker to be treated as a separate group. Chirag is the 6th MP.
6 सांसद हम लोग हैं। 5 सांसद की इच्छा थी 6 महीना से कि हमारी पार्टी का अस्तित्व खत्म हो रहा है, इसलिए पार्टी को अब बचा लीजिए। तो मैं पार्टी तोड़ा नहीं हूँ, मैं पार्टी को बचाया हूँ।
For Bihar Chief Minister, Chirag's crisis is revenge for breaking their alliance in the last year's election, effectively reducing the JDU to the 3rd position.
एक कहावत है, as you sow, so will you reap. जो बोइएगा उसको काटिएगा।
Despite a compromise formula offered by Chirag Paswan, his uncle Pashupati Paras and other MPs are in no mood to grant any concession to him anymore. And it seems clear that if he wants to stay relevant in Bihar politics, Chirag Paswan will have to start from the scratch. With Rajiv Ranjan in Delhi, with cameraman Habib Ali, this is Manish Kumar for NDTV.
Well, on to the other big political focus. Politics is once again hotting up as far as the Rajasthan Congress is concerned. Now, Sachin Pilot has been in Delhi since the weekend to resolve issues with the party high command. 11 months after his rebellion, neither of his loyalists or his men have found a berth in the Gehlot cabinet. Neither have they been placed in important political appointments. This is the full report.
A tug of war in the Rajasthan Congress, different factions pulling in different directions. Now a sharp reminder from the former BSP MLAs who clearly want their pound of flesh ahead of a possible cabinet rejig.
इसमें तो कोई ज़्यादा दिमाग लगाने वाली बात कोई इसमें तो कोई मैथ्स कोई गणित है ही नहीं। आज से लगभग 1 साल पहले 11 महीने हो गए 19 विधायक कांग्रेस को छोड़ के चले गए थे और यदि वो 19 विधायक कांग्रेस से चले गए थे यदि 10+6 हम नहीं होते तो आज सरकार की प्रथम पुण्यतिथि की तैयारी होती।
Sachin Pilot is in Delhi since the weekend. The High Command has promised to help, redress his complaints 11 months after he raised the flag against Gehlot. His men are yet to get a cabinet berth and party workers are not being accommodated in political appointments. When just last year, Dr. Manju Sharma, the wife of Kumar Vishwas, found a place in the Rajasthan Public Service Commission. And soon after, Sheetal Dhankar, niece to Bengal Governor Jagdeep Dhankar and daughter of one of the CM's confidants, Randeep Dhankar, was nominated to the Information Commission. But the government says tackling corona is taking up most of their time.
ये सब नियुक्तियां लेट हुई है या कैबिनेट एक्सपेंशन की बात है, ये सब तय करना कब कैसे क्या होगा, क्योंकि इस वक्त 30 में से 21 तो बने हुए हैं, 21 तो कैबिनेट में है ही। ये सब और खुद चीफ मिनिस्टर आप बताइए, तीसरी बार सीएम अशोक गहलोत जी, उनको कौन ज्ञान दे? वो खुद खिलाड़ी आदमी है, बहुत एक्सपीरियंस्ड है और इस वक्त लोगों को, आम जनता को मैं कह रहा हूं, ना तो किसी और पॉलिटिकल एक्टिविटीज से मतलब है, उनको मतलब है कोरोना में हमारी जान कैसे बचेगी।
But the pilot camp refuses to lie low. From expressing discontent to accusing the government of phone tapping, they are dominating the headlines.
कई विधायकों ने जरूर कहा है कि फोन टैप हो रहे हैं, उसके साथ साथ में कई विधायकों ने, उन अधिकारियों ने ये भी कहा है, उनको डराने की कोशिश भी की है कि हमारे ऊपर से ऐसे इंस्ट्रक्शन आ रहे हैं, ऐसा लगने मिल रहा है कि जिससे कोई ट्रैप कराने की कार्रवाई हो रही है या ईसीडी पीछे लगी हुई है। इस तरह के इनको विधायकों ने कहा भी है बात।
But what's the arithmetic now in Rajasthan? Have pilots' supporters shrunk in numbers or has the discontent spread? Is a question that is being asked. In Jaipur, Harsha Kumari Singh, NDTV.
Welcome back. The big story we're tracking from Uttar Pradesh. A television journalist based in Uttar Pradesh's Pratapgarh district died on Sunday night in what the police have called a motorcycle accident. But just a day before his death, Sulabh Srivastav, who worked for ABP News and its regional arm, ABP Ganga, wrote to senior police officials saying that he felt threatened following his recent reportage of liquor mafias in the district. Here's what the Uttar Pradesh's journalist's wife had to say. She alleges that he was murdered.
लेकिन जहाँ तक 3 दिन से ये परेशान तो थे कि हम कहीं जा रहे हैं तो हमारा कोई पीछा कर रहा है। इस बात से हमको ये लगता है कि ये हत्या भी हो सकती है। सरकार से हमारी मांग यही है, हमको न्याय, सबसे पहले तो हमको न्याय मिले। सच्चाई के साथ अगर आज हमारा पति दिया है तो उसको क्या मिला? 24 घंटे में आज वो हमारे पास रहा नहीं, तो मतलब जो सच्चाई का साथ देगा वो रहेगा ही नहीं और जो झूठ का साथ देगा वो सर उठा के जिएगा। तो हमको चाहिए न्याय। और हमारे 2 तो छोटे छोटे बच्चे हैं, एक 7 साल का बच्चा है, एक 11 साल की लड़की है, तो उसको हम कहाँ से खिलाएंगे, कहाँ से पिलाएंगे, हम क्या करेंगे? मेरे घर और कोई अर्निंग भी नहीं थी, उनकी पत्रकारिता से ही हमारे घर में रोटी नमक चल रही थी, जो चल रही थी।
Let's go right across to Alok Pandey, tracking the details of this story. Alok, the police claims that this is a motorcycle accident, but we just heard the wife of the journalist who is very clearly alleging foul play.
Well, yes, all of these events happened on Sunday, and the police have now gone ahead and filed a murder case based on a complaint given by the wife of the killed journalist, of the journalist who died. Mr. Sulabh Srivastav used to work with ABP News, which is, as we know, a Hindi channel, and it has a regional wing too called ABP Ganga, so he used to work for both those channels. He was returning from a news coverage late on Sunday night. The police version is that his bike collided with a hand pump on the side of the road and he fell down. But images from the accident spot show him lying on the ground with his clothes, most of his clothes apart, and lots of injuries to his face and head also. So how that happened is a matter of investigation. The other important aspect of the story has been, of course, that we reported earlier too, has been how Mr. Srivastav had written a letter to senior police officials in Pratapgarh and in the zone that supervises it, which is Allahabad or Prayag. And he had said that in the past sometime his reportage on liquor mafia in the area had led to some murmurs and chat, and as journalists we do pick up these chats happening about how, some goons were unhappy with his reportage and that he felt that every time he stepped out of home, he was being followed and that his life could be in danger and he asked for protection. The police acknowledges that they received the letter. They claim that they did ask local cops to take care or to at least try and get into the allegations. But before all that could happen, Rishika, as you know, the gentleman died, and it's up to the police now to investigate this in a fair manner.
Right.
And the police were saying yesterday, last I checked, that they feel that the post-mortem report and the initial investigation does point to an accident.
Right.
But they will investigate all angles. And that is what everyone wants, that all angles be investigated fairly and that the truth should come out.
All right. Well, one sincerely hopes that there is a fair investigation into the death of the journalist. The wife, of course, is very clearly there alleging foul play. The police so far had, remember, claimed this was a motorcycle accident. Thanks, Alok, for joining us with the very latest. We'll keep a close watch on those developments. Short break. We'll bring you more news on the other side. Stay with us. All right, well, let's get you the other big developments that we're tracking now. Severity of COVID-19 depends upon the rate of vaccination. And of course, this is very relevant when it comes to talking about the third wave of COVID in India. The projections shown here for the month of December are based on the relative performance of each state in vaccinating its population so far. In other words, those states which have a poorer rate of vaccination at the moment could potentially face a greater vaccination burden in December. This becomes doubly true in case of those states which have vaccinated poorly and have a large population, states like Uttar Pradesh, for instance. Finally, this projection takes into account one key factor. It revolves around those who have received 2 doses of the COVID-19 vaccine. So, the number of hotspots in the potential third wave of India would depend upon the vaccine coverage, both shots of vaccine coverage in India by then. Now, the vaccine rates have once again appeared to plateau. Doses on Sunday, for instance, fell to 14 lakhs. The overall daily doses are averaging about 30 lakhs a day. However, this rate is just not enough to meet the government's own target to fully vaccinate all adults in India, which is an estimated 108 crore by the end of the year. At the current average, it is estimated that the number of daily doses should be roughly 3 times higher. We need to be vaccinating at least 95 lakh people on a daily basis instead of the current 30 to 31 lakh that we're doing. So, at the current rate, if we continue at the current rate, which is averaging around 30 lakh vaccinations per day, which is a slower rate than what we need, it will take us more than 20 months to vaccinate our entire population. The government's target, remember, is to vaccinate the entire country in the next 6 months before the end of the year. Now, let's also get you the other big story that we're tracking, which is on the vaccine front again. Novavax has announced that its COVID-19 vaccine is more than 90% effective. This is currently a claim by Novavax. It has not yet been peer-reviewed. It's a company claim based on a trial that was conducted in US participants. Now, interestingly, the company also claims that the vaccine is effective against coronavirus variants of interest and variants of concern. This is an announcement that was made after a large-scale study that the company conducted in the United States, which involved nearly 30,000 people. The participants in the study were from the United States as well as Mexico. Now, the company has released these results on Monday, showing that the vaccine was an overall 90% effective. Novavax, remember, has a tie-up with the Serum Institute of India. So, the Serum Institute of India, which is also manufacturing Covishield, is going to be manufacturing Novavax, and therefore, this is in fact a vaccine that has once again raised hopes for India. Here are the details. All right. Well, what does this mean for India? We have with us Dr. Sailesh Jain, CMD of Universal Hospital, joining us from Delhi. We have Dr. Dhiman Kahali, Director Interventional Cardiology, BM Birla Heart Research Institute, joining us from Kolkata. Thank you very much, doctors, for being with us. It is indeed another ray of hope as far as vaccines are concerned. Dr. Jain, if I can begin by asking you, the Novavax vaccine has claimed a 90% overall efficacy. They've also claimed that it will be effective against variants of interest, variants of concern. This is, of course, yet to be peer reviewed. But what's your initial reaction?
I have 4 points to say. First is, you have to understand, for them it is a business. For me and for my country, it is saving the life of my citizens. So first thing, you have to understand the Novavax is still not been approved by the country of origin. The USA FDA has not approved the Novavax for use in their country. If they have not approved the vaccine in their country, I am not able to understand why we are talking about the red carpet welcome in our country. Now, second is come to the efficacy. Efficacy, there are two, like you said, there is a variant of interest, variant of concern. Till now, WHO has designated 4 mutant as a variant of concern. Variant of concern, one is B1.75, B1.351, then P1, and another is Delta variant, which causes the huge catastrophe in my country. The 30,000 participants which has been included in PREVENT trial, they have taken only 2 variants of concern. First is B1.1, that is alpha variant, and second is beta variant. Against the alpha variant, it has an efficacy of 86%, but against the beta variant, which has caused the catastrophe in the South Africa, it has only efficacy of 46%. This is what the company has quoted on their website. So on another variant which has caused the catastrophe in my country, they have trial has been done for our variant third. Then now come to the Serum Institute of India. I am not able to understand. Serum Institute of India is their valuable partner as a manufacturer in our country. If Serum Institute of India has a capacity to produce another 5 crore vaccines for another company, why not Covishield only? If you have an infrastructure to produce extra production for the vaccine, I personally feel they should go for the Covishield. Rishika, you have to understand, anybody, be it hospital, be it pharma company, be it vaccine manufacturer, be it oxygen vendor, if they use this opportunity to make the money to loot the country, government should take harsh action. Now the last point is, PREVENT trial has been conducted on 30,000 participants. But in my country, Serum Institute is saying that they will conduct the trial on 1,600 people in 15 sites. How can you assess the third trial in only just the very small number of the cases?
Right.
So I personally feel,
if I'm not wrong though, I think Dr. Jain, the Covishield trial in India was also conducted on a similar sample size. You can correct me if I'm wrong there. Dr. Kahali, your first reaction to Novavax, do you think it presents itself as hope for another vaccine?
So it's a very good news that we have got Novavax in our kits, because we are severely lagging in our endeavor to complete the vaccination. And there is a gross disparity between the vaccination in the rich countries, that is the G7 countries, who recently made in southwest of UK, and the poorer countries. And the ratio is as big as 1:73. As evident from your slides which you have been showing, that only 4-5% of our population has got 2 jabs, and 30 crore persons has done 1 jab according to the government notification. And it will be not completed even by the December 2022 if it happens in this rate, because we are giving 30 lakhs vaccination per day, 31, instead of requirement of almost 1 crore daily. Then you can finish it little earlier. But the situation is very grim, and we are not being able to vaccinate all the people. And there is a big disparity between the richer nations and nations like us. But one good thing is that, which we discussed on the other day, yesterday also some literature showed that Covishield vaccine is acting very good against the Delta variant, and it is not inferior to, though there was no head-to-head trial, to the Pfizer vaccine. Though Antonio Fauci, in a recent interview in your channel, claimed that in 88% of the case, their Pfizer vaccine is acting against this Delta strain.
Yes.
So we are now more concerned about the Delta strain. because in like UK, we are also facing the same Delta strain.
Well, absolutely. We have the variant dominant here in India. The UK is actually deferred unlocking its country by another 4 weeks because of this variant. We, on the other hand, are opening up quite quickly as compared to the UK. Let me also get in a word from Professor Dr. Anita Ramesh Chandra. She is a specialist in clinical trials, senior medical oncologist, Apollo Speciality Hospital, joining us from Chennai. Dr. Anita, very quickly, your reaction to this news of the Novavax vaccine. Do you think this is vaccine hope, renewed vaccine hope for India?
Yes, you're definitely right. Yes, we are going to be very hopeful because we saw the results of the phase 3 data, that is the Prevent-19 trial on 30,000 people in US, and it has overall 90% efficacy, and that's extremely good news. It has 100% efficacy in moderate and severe disease. It has shown even 93% efficacy on the running strains now, as well as the strains which are not of concern. Even if that has shown 91%. And being an mRNA which can be stored in 2 to 8 degrees centigrade in a country like India, if it is produced mRNA and stored at that temperature, cold chain can be maintained and the whole country can use it. And in the pandemic, now we really need something like this. And it has also shown 90% efficacy in the high-risk individual. And that's the country or the world needs at this point of time. The results are very fascinating. And also the very good news that Serum Institute is going to manufacture it. I'm very happy. Yes, it's an Indian-produced vaccine. It will be, and I'm sure it will help the entire country.
Two quick questions. One, on the fact that these are based on trials conducted on 30,000 participants in the United States right now. Will we expect to see trials here in India? And we are told that the company could be seeking regulatory authorization in India sometime in the July to September quarter. What according to you, is then a realistic timeline?
Yes, one thing is very important. Usually, I'm with the clinical trials in India for the last 20 years. You do need the DCGI, the drug controller approval for anything that comes over here. At least you have to do some portion of the trial. But what happens now is that because of the pandemic, and there is a criteria in the rules and regulation which says emergency approval of the vaccines.
Yes.
So like how Pfizer, we have granted emergency approval without the study in India. I'm sure this Novavax from the US company also being manufactured in Serum Institute will get emergency approval during the pandemic. You might not need to, because we don't have the time, because you have to save the population. You may not need the study in India based on studies which are available in public domain and proper in high index journals. Do we go by that and say.
Very briefly before we let you go, any rough timelines on when this vaccine could actually be rolled out in India?
Yes, see, if you see the US approval, I think they're still waiting a month
for FDA approval.
Maybe July. Yes, every approval has not come for this vaccine. So until and unless some approval is there, we cannot start in India. You are right with the timelines, July, August, September should be are hoping. But before the third wave comes in, we have something with us.
All right. So the Novavax, they're announcing a 90% overall efficacy. Could this be renewed hope for India, given the fact that it is the Serum Institute that is going to be manufacturing this particular vaccine? This data, of course, has not been peer reviewed just yet. It is a company claim. Thank you all very much for joining us. We'll keep a close watch on all these developments. Welcome back. On to the other big story. We're tracking inflation based on wholesale prices hit an all-time high of 12.9% in May. This on the back of higher fuel and edible oil prices. The retail inflation has also hit a 6-month high. Now, fuel prices are at historic highs in many cities, and of course, all of this is impacting your budget. NDTV's Bureau's report.
Wholesale inflation has hit an all-time high of 12.9%. The government says this is an anomaly due to a low base effect. However, retail inflation has also jumped to a 6-month high of 6.3%. Wholesale inflation has been pushed up by fuel prices going up 37.6%, edible oil up nearly 50%. Meanwhile, overall wholesale food inflation has moderated to 4.3% from 4.9% in April. But this level of inflation is hurting household budgets across the country. With tighter budgets in the pandemic, the purchasing power for necessities such as edible oil is now a worry.
रिफाइंड हम लोग 70-80 रुपए का लाते थे, अभी 150 का हो गया, वो भी डबल दाम हो गया। तो क्या कर सकते हैं, हम लोग गरीब आदमी हैं, मेहनत करते हैं, कोठी में काम करते हैं, तो इतना तो बजट उठा नहीं सकते हम लोग।
Petrol above 102 rupees a litre in the financial capital of the country. Those resuming work with restrictions easing are now wondering how will they manage to afford daily commute.
पेट्रोल डीजल के दाम पे जो एक्सेस इतना लगा रखा है उसमें पब्लिक को रियायत देना चाहिए, अदरवाइज जो है सारा अर्थव्यवस्था पहले से गड़बड़ है आदमी का और गड़बड़ हो जाएगा।
सरकार का नियम ही है, सब चीज़ पे दाम जब काजे बोल जाता है, तेल महंगा हो गया, सरसों तेल 200 रुपये किलो, तब तो पेट्रोल ही है, आम आदमी को तो फर्क बहुत पड़ेगा।
And it doesn't just end there. The price of soaps for daily care and hygiene also has jumped by nearly 10%. With India's unemployment rate above 10% according to Centre for Monitoring Indian Economy, and with businesses trying to cut costs, household budgets are now getting tighter. Bureau Report, NDTV.
And the story of Sajid Noor and Jahangir Lone is our Lottoland Aaj Ka Sitara for the day. As the son of a daily wage labourer, Sajid Noor, along with his friend Jahangir Lone, saw an opportunity to create a portable cloud-based ventilator given the shortage of ventilators during the second wave of Covid-19 in India. They are our Lottoland Aaj Ka Sitara. Lottoland will support their cause with a cash incentive of 1 lakh rupees.
Two young students of electronics in Srinagar decided to put extra time in the lockdown to good use. Seeing the shortage of ventilators, they came up with an idea to make a portable ventilator that is accessible, affordable, easy to use, and most importantly, user-friendly.
My father, who is a labor by profession, couldn't go for work, but the first thing which was a priority of mine or ours was to build something for the nation, because the nation was struggling with the shortage of ventilators, and we built a small low-cost crucial ventilator from the scrap which was available at our homes.
The son of a daily wage labourer, Sajid Noor, worked with his friend Jahangir Lone on scrap material. Unlike traditional ventilators, this has sensors that monitor resuscitation and also digitally note vital parameters of a patient. Sitting in a hospital, doctors can monitor how this ventilator is working through a cloud-based software, and it works quite easily through a mobile phone. The young students, both in their early 20s, hope their model can be replicated to help patients in this time of crisis.
Because why we embed the internet with this, actually in order to monitor the patient's real-time data, as I mentioned, like ECG, temperature, body positioning on real-time data, so that the doctor can advise from anywhere.
Sajid and Jahangir are real COVID heroes. They have not only made a portable ventilator from scrap material, it has also been embedded with internet facility so that doctor can monitor patient's condition from anywhere and anytime. The innovation has been recognized by the National Institute of Technology, Srinagar. Both Sajid and Jahangir have got first position during COVID-19 Open Innovation Challenge. While Sajid didn't allow livelihood issues to come in his way to build a cloud-based ventilator, his true friend and colleague Jahangir was there to make the innovation a reality.
Welcome back. On to the other big story that we're tracking for you today. India has seen a record wholesale inflation in the month of May. It is at 12.9%. The May wholesale inflation has spiked to 12.9%, as opposed to an 10.4%, which is what it was in fact in April. So that is the latest number that we have for you. Let's also take a look at the fuel and power inflation, which spiked to 37.6%. Versus 20.9% in April. So this, of course, is the other interesting development that has in fact taken place. What are economists really saying about this? Well, they say that the rise in oil prices, the weakening of the rupee and an upward revision in fuel rates are the key risk factors that have in fact led to this surge in numbers. The government sources are also indicating to us that this is primarily due to a 37.6% yearly increase in fuel and power inflation. Now, this is the big cause of concern. This is an anomaly due to a low base effect and rise in prices of crude. So that's what government sources have indicated to NDTV, while of course talking about this record number of 12.9% that we've seen in the month of May. Government sources have also said that the increase in fuel prices will have only a limited impact on people's pocket. Now you'd wonder why and what the justification is. Well, the government says that restricted movement on the back of regional lockdown. So the government actually has interestingly said that the impact of this wholesale inflation that is currently extremely high at 12.9%. It is a record. The government says that this is not going to be impacting the people's pocket as much because people are largely living in some varying degree of Covid-19 restrictions and lockdowns, which are of course state specific at the moment. So at the back of this restricted movement, at the back of regional lockdown, government sources actually indicate that this number, though worrying, may not have that much impact on people's pockets due to the restriction in movement, especially as a result of varying degrees of lockdown. But it is still a record wholesale inflation in May that is at 12.9%. We'll keep a close watch on the story as well as the impact that it has. Short break here. We'll bring you more news on the other side. Stay with us. Welcome back. On to the other big story we're tracking. While there are concerns about India's slow pace of vaccination, here's good news from a village in Ludhiana. This particular village, called Bhik village of the Payal constituency, has become the first village in the state to vaccinate 100% of its population in the 18+ category. Here's the full story.
As vaccine and testing hesitancy has been reported from multiple villages in Punjab, this village in Ludhiana district, Bhik village, has achieved a unique feat. It's a story of collective efforts of healthcare workers, villagers, the village sarpanch, that the entire 18+ population has been inoculated with first dose.
As Gurnal Singh recalls, the last time he had a vaccine was of polio.
ठीक लग जी बिल्कुल मैंने कोई बुखार नहीं होया कितने बारी लवाया 2 बार लवाया मैं कहूँ जी लवा लो औखे सौखे कोई गल नहीं कोई पैसा नहीं लगना कुछ नहीं लगना.
The 100% vaccination cover is largely thanks to these 5 healthcare workers. Besides motivating the rural population, they had to also fight out the social media misinformation.
थोड़ी पॉपुलेशन ऐदा भी सी जेड़े जिद्दां लाइक सोशल मीडिया ते काफ़ी ज़्यादा लोग प्रभावित होंदे ने भी ਉਹ ਕੋਈ ਕਹਿ ਰਿਹਾ ਵਾ ਵੀ ਇਸ ਨਾਲ ਡੈਥ ਹੋ ਜਾਏਗੀ ਤੇ ऐदा ਸਾਨੂੰ ਉਹਨਾਂ ਦਾ ਵੀ ਬਹੁਤ ਮੁਸ਼ਕਲਾਂ ਦਾ ਸਾਹਮਣਾ ਕਰਨਾ ਪਿਆ.
The population of Bhiki is 1700. 947 residents are above the age of 18 years. Except 18 pregnant women and some people unfit for vaccination due to health issues, all 905 eligible people have been vaccinated. The achievement of this village is now spreading far and wide, motivating even outsiders to come and get vaccinated.
ਰਾੜਾ ਸਾਹਿਬ ਤੋਂ ਆਏ
ਤੇ ਤੁਸੀਂ ਇਸ ਪਿੰਡ 'ਚ ਟੀਕਾ ਕਿਉਂ ਲਗਵਾਇਆ ਨਾ ਹੋਇਆ ਦੱਸੋ.
ਕਿਉਂਕਿ ਇਸ ਪਿੰਡ 'ਚ ਸਾਰਿਆਂ ਨੇ ਇੰਜੈਕਸ਼ਨ ਲਗਵਾਇਆ ਤੇ ਸਾਨੂੰ ਕਿਸੇ ਨੇ ਸੁਜੈਸਟ ਕੀਤਾ ਸੀਗਾ ਉਰੇ.
The Chief Minister had announced that the villages which will go for full vaccination or achieves the 100% target of vaccination will be awarded 10 lakh rupees. Now hopefully the story of Bhik village in Ludhiana will inspire the neighbouring districts, the neighbouring villages, and everybody will come out and go for vaccination. With Gurmeet in Ludhiana, Mohammad Ghazali for NDTV.
All right, breaking news coming in. There have been over 60,000 new coronavirus cases in India in the last 24 hours. The tally is 60,471 cases in 24 hours. 2,726 deaths have also been reported in this time period. The total number of active cases in the country is below 1 lakh, currently at 91,000. Active cases in the country. Recoveries in the last 24 hours have also been high. Vaccinations, interestingly, in the last 24 hours are breaching closer now to the 40 lakh mark. There have been 39.27 lakh vaccinations in the last 24 hours. 17.5 lakh people have been tested. The positivity rate in the country is at 3.45%. It is for the 8th consecutive day that the positivity rate in India is below 5%. So this, in fact, is the lowest number of cases that India has reported since March. What we are, in fact, learning is that 60,471 new cases have been reported in the country in the last 24 hours. The good news continues to remain positivity rate below 5% for 8 straight days. And the pace of vaccination seems to have picked up in the last 24 hours with close to 39.5 lakh people, 39.27 lakh to be precise, getting the COVID-19 vaccine in the last 24 hours. Well, we'll keep a close watch on all those COVID numbers, lowest since the 31st of March there. We'll continue to bring you the very latest. Meanwhile, let's shift our focus to the other big political story we're tracking. Now, Congress politics is heating up in Rajasthan once again, with Sachin Pilot in Delhi since the weekend to resolve issues with the party high command. It's been 11 months after the rebellion, and neither of the Pilot loyalists seem to have found a berth in the Gehlot cabinet, nor have they been accommodated and given appropriate political appointments. Here's the full report.
A tug of war in the Rajasthan Congress, different factions pulling in different directions. Now a sharp reminder from the former BSP MLAs who clearly want their pound of flesh ahead of a possible cabinet rejig.
इसमें तो कोई ज़्यादा दिमाग लगाने वाली बात, कोई इसमें तो कोई मैथ्स, कोई गणित है ही नहीं। आज से लगभग 1 साल पहले 11 महीने हो गए, 19 विधायक कांग्रेस को छोड़ के चले गए थे, और यदि वो 19 विधायक कांग्रेस से चले गए थे, यदि 10+6 हम नहीं होते तो आज सरकार की प्रथम पुण्यतिथि की तैयारी होती।
Sachin Pilot is in Delhi since the weekend. The High Command has promised to help, redress his complaints 11 months after he raised the flag against Gehlot. His men are yet to get a cabinet berth, and party workers are not being accommodated in political appointments. When just last year, Dr. Manju Sharma, the wife of Kumar Vishwas, found a place in the Rajasthan Public Service Commission. And soon after, Sheetal Dhankar, niece to Bengal Governor Jagdeep Dhankar and daughter of one of the CM's confidants, Randeep Dhankar, was nominated to the Information Commission. But the government says tackling corona is taking up most of their time.
ये सब नियुक्तियां लेट हुई है या कैबिनेट एक्सपेंशन की बात है, ये सब तय करना कब कैसे क्या होगा, क्योंकि इस वक्त 30 में से 21 तो बने हुए हैं, 21 तो कैबिनेट में है ही। ये सब, और खुद चीफ मिनिस्टर आप बताइए, तीसरी बार सीएम अशोक गहलोत जी, उनको कौन ज्ञान दे? वो खुद खिलाड़ी आदमी है, बहुत एक्सपीरियंस्ड है, और इस वक्त लोगों को, आम जनता को मैं कह रहा हूं, ना तो किसी और पॉलिटिकल एक्टिविटीज से मतलब है, उनको मतलब है कोरोना में हमारी जान कैसे बचेगी।
But the Pilot camp refuses to lie low. From expressing discontent to accusing the government of phone tapping, they are dominating the headlines.
कई विधायकों ने जरूर कहा है कि फोन टेप हो रहे हैं, उसके साथ साथ में कई विधायकों ने, उन अधिकारियों ने ये भी कहा है, उनको डराने की कोशिश भी की है कि हमारे ऊपर से ऐसे इंस्ट्रक्शन आ रहे हैं, ऐसा लगने मिल रहा है कि जिससे कोई ट्रैप कराने की कार्रवाई हो रही है या ईसीडी पीछे लगी हुई है। इस तरह के 1-2 विधायकों ने कहा भी ये बात।
But what's the arithmetic now in Rajasthan? Have Pilot's supporters shrunk in numbers, or has the discontent spread? Is a question that is being asked. In Jaipur, Harsha Kumari Singh, NDTV.
Well, a shocking story that we're tracking from Bengal now, where a tribal woman in North Bengal was dragged out of her house, stripped, paraded naked and filmed by miscreants, allegedly as a punishment for an extramarital affair. The incident occurred on the night of the 9th of June, Wednesday, in the Alipurdwar district police station area. The shocking incident only came to light on Sunday after videos of the woman surfaced on social media. The police tracked down the woman at her parental home in neighbouring Assam and brought her back. She's now filed a police complaint naming 11 persons in her FIR. 6 of them have since been arrested and raids are on to track down the others. Among the various IPC sections the accused are being charged with is Section 307 or attempt to murder. Several right-wing organizations have tweeted about this incident, accusing the administration of silence and inaction. The local Trinamool leader has condemned the incident and called for the harshest punishment. And 2 gang rape survivors from West Bengal have moved the Supreme Court for an SIT probe into post-poll violence. Both have alleged that they were gang raped by TMC goons. One of the survivors in her plea says that she was gang raped by TMC supporters and workers in front of her 6-year-old grandson, and then they then took her cash and jewellery away. The Supreme Court had already issued notices to the West Bengal state as well as the centre on the plea by the families of 2 victims who died in the post-poll violence. Both survivors want to be party to the pending PILs by families of the 2 victims in the post-poll violence. Let's go right across to Monideepa joining us with the very latest. Monideepa, this case is likely now to be taken up today.
That's right. That's what we've been told by lawyers involved in the case, that the Supreme Court will hear today the plea of these 2 women who have claimed that they were gang raped here in Bengal just after the elections. One of them, the older woman, she was gang raped on the 9th of 4th and 5th May in her home, and the other younger 17-year-old who was gang raped on 9th of May. This young girl is also a member of the scheduled caste community, which is why other commissions are also looking into the whole matter. These 2 gang rapes are also now impleaded into the bigger case of post-poll violence in Bengal, in which families of 2 persons who were killed in post-poll violence allegedly have gone to Supreme Court in the matter. So has the West Bengal government. We are being told the West Bengal government has said to Supreme Court in an affidavit that just because a violent incident has occurred after the polls does not mean it is a political post-poll violence. Matter will be heard today. Hugely sensitive case. 2 women have recounted gory and horrific details of what they underwent in their application to Supreme Court. All eyes, at least on West Bengal in political circles, on what happens at Supreme Court today.
Welcome back to our special campaign, Vaccinate India, in partnership with Google. We're discussing questions you may have about the COVID-19 vaccines. We all take to Google to answer several of these questions. Today on the broadcast, we have an expert doctor to take on some of your frequently asked questions. Dr. Sameer Gupta, Director, Cardiac Cath Lab, Metro Group of Hospitals, joins us from Delhi. Thanks so much for being with us, Doctor. One of the most commonly asked questions still is, are COVID-19 vaccinations, the vaccines available, are they safe given the fact that they've been developed in a very short span of time?
Yes, the answer is absolutely they are safe. And there is absolutely no reason why most people should not get the vaccine. Everyone above 18 years of age should go and get the vaccine, because that is the only way that we will end the pandemic. Yes, people often ask me this question too, that, the vaccines have been developed in a very short period of time. Are they safe? There are 2 important points for this. One is that the research and technology has changed a lot than what it was maybe 30 years ago, right? So we have been able to do these experiments and develop the vaccine much faster. The second very important point, which is often missed, is that when you test a vaccine, you need to have exposure to the possible infection to see is it effective or not, right? So if I give a subject or a test subject a vaccine who's a volunteer, I give him a vaccine. The question is this vaccine effective or not? For that, this person will have to be exposed to the infection somehow in the community, right? Now, when you think of something like measles, what is the community spread of measles? It is very, very small. So your chances of being exposed to measles, to say that the vaccine is effective against measles is very small. But when you're in the midst of a pandemic, and there are so many people around who are carrying the infection, your chances of getting exposed to the possible infection are much higher.
Right.
So the trials can be finished in a much shorter period of time. So that is why the vaccine was there in a comparatively much shorter period of time. And yes, please do get the vaccine. It is very safe.
Right. When we talk about the safety of COVID-19 vaccines, I think, Doctor, it's also very important to address some of the common side effects that may happen after you get vaccinated. What should people be prepared? What are the most common side effects that you may face after getting the COVID vaccine?
Yeah, so the most common side effect is you may get a little bit of a sore throat, some body aches, mild fever. You may just feel a little lethargic for a day or so. And soon after, and the next day, it just gets better. It's like nothing ever happened. So when I got the vaccine, I did not get anything. My parents were absolutely fine. The three of us got the vaccine together. We didn't. But a friend of mine who got the vaccine the same day, that evening he had a little bit body ache, maybe a little bit fever.
Right.
And the next day he was fine. And in fact, the next day I went for a 5-kilometer run. So, it was absolutely fine, get the vaccine. The flip side of getting COVID is much worse.
Is it true, though, that, individuals who have, say, got infected with COVID are more prone to side effects, more prone to getting a fever or a headache or chills like you're talking about, as opposed to those who have not been exposed to the infection?
That's kind of debatable. Everybody has these individual reactions, right? One person may react to the vaccine in one way and the other person in a completely different way. I got COVID and I got the vaccine and I was safe. I did not get any symptoms whatsoever. So I don't think we should look at it that way. And even if you have the symptoms, they're so slight, so mild, and the last was so short, such a small period of time that you'll be fine. I mean, let that not be a deterrent.
Should you take symptomatic treatment? Should you take medicines for these side effects?
So on a case-by-case basis, you can take it. Drink a lot of water. Keep yourself very well hydrated. Some people after the vaccine, if you have some body ache, you can take a paracetamol. But that should be, you have to discuss that with your doctor, whether it is safe for you to take paracetamol in general. This is not something that can be mass, it's not that everybody can take paracetamol. So it has to be on a case-by-case basis. But yes, you can take a paracetamol or a antipyretic drug if needed.
All right, Dr. Sameer Gupta, thanks so much for joining us with those important clarifications about the COVID vaccine.
Thank you.
Welcome back. Let's get you an update as far as the markets are concerned this morning. What we're learning is that the Sensex is in the green, 273 points up, trading almost 0.52% in the green. The Sensex currently at 52,824 in this morning's opening trade. Let's take a look at the top gainers in the Sensex. Indiabulls Housing, ICICI Bank, UPL all firmly in the green. Indiabulls Housing gaining almost 2.88%, trading at 307.05. ICICI Bank almost a percentage point up, trading at 641. UPL up almost 0.9%, trading at 842. Britannia, Indus, the Entertainment, IOC all in the top gainers. Britannia Indus is up 25 points, trading at 3,616. I beg your pardon. The Entertainment up 0.66 points, trading at 219. IOC up 0.61 points, trading at 115.45. Let's also get you the top losers. Tata Motors, Coal India Adani Ports and SEZ. Tata Motors is down 0.72%, trading at 353. Coal India trading at 158, down about 0.69%. Adani Port and SEZ down 0.68%, trading at 763. Cipla, Dr. Reddy's and Grasim Industries also in the red. Cipla is down 0.37%, trading at 972. Dr. Reddy's trading at 5,444, down 15 points. Grasim Industries trading at 1489, so below 1500, down 0.17% now. Oil and gas stocks, well, GAIL India, ONGC, Oil India, all in the green. GAIL India is 0.8% in the green, trading at 164. ONGC trading at 125, and Oil India over a percentage point up, trading at 144.75. Let's take a look at the auto stocks and how they're faring. Tata Motors is down 0.62% at 353. Maruti Suzuki up 13 points, trading above 7,100 this morning, 7,190. M&M is also up 0.27%, trading above 800. So that's the Sensex as of 9:54 a.m. 52,837 is the Sensex, up to 85 points now, up almost 0.54%. We'll keep a close watch on the markets. That's all the time we have. We'll bring you more news on the other side. Stay with us.